Good evening, everyone. We'll give it just one more minute as we get a couple more people getting in, and then we'll get started.
It's awesome as I'm scrolling through to not see anybody asleep. It is 6:30. We had a time change a week ago, and so it's still good to see everybody so fresh and bright. I think we can go and get started, Megan.
Yeah, I think so. We've had a few people trickle in and may have a few more join us. But yes, as Melissa said, thank you all so much for being here this evening. We know evenings can be tough, but we are very happy to host them so that we can have more of our childcare providers join us, which is super important. So excited to have you all here today. I'm going to do a quick overview of the agenda, and then I'm going to hand it back to Melissa for some updates. So like I said, we'll start with a few updates from KDHE. We have some exciting updates to share on the recommendations that have previously been put forth through the CCSIT, as well as some just early childhood system updates. We just want to make sure there's a lot, there's I think even more than normal going on right now. So just want to make sure people are hearing information in multiple places and aware of those resources. And then we'll do our bright spots and just kind of group updates, and then talk about the work groups. We're going to spend a little bit of time in our work groups today, but it's actually most of our time is going to be here as a full group talking through the recommendations and seeing what questions people have and just making sure we feel really good about what the groups are proposing putting forward. So with that, I'm going to hand it back to you, Melissa, for any updates on KDHE side.
Yes, I'd like to welcome Derek. And Derek, I don't even want to butcher your last name. So if you want to come off a mute and introduce yourself. Derek is our new Bureau of Family Health Bureau Director, and he is specifically working with child care licensing. He's been on board 5 weeks. And it has been a very fast and furious 5 weeks. So Derek, if you would like to come off mute and introduce yourself.
Yeah, thanks, Melissa. Hey, everybody. I'm Derek Flerlog, and I never expect anybody to know how to say that or to remember how to say that. And yeah, I've been here 5 weeks. A little bit about me, just some background. So I spent some time as the infectious disease manager and chief of COVID operations for Shawnee County. So I interacted quite a bit with childcare in that capacity and worked pretty closely here with the county. And so that's really been my background in childcare. Of course, like everybody likes to say, I am a dad. So I have three little ones. Well, one not so little one, he's 10, and 2 little ones that do go to an in-home childcare. So that's, kind of my personal experience with it too. And prior to this, I was a senior administrator for a nonprofit healthcare company. I did that for about 10 months. And then I was like, I want to go back to public health. And so here I am in this capacity, and just really, I'm excited to be here. First off, I know there's a lot going on, but we have an awesome team. We really do. And just those I've interacted with, whether it's in childcare or one of our other programs, public health is a setting in which people certainly don't do it for the pay. And so what drives them, their passion, everyone's a little bit different as far as that goes, but just people that are really in it for what we would say are the right reasons. And I'm really passionate about this. And I just love the community that we have and the different programs and things that we offer. And childcare is one of those. And as you all well know, just whether it's providers, whether it's the kiddos, whether it's us, on the admin side of things, talking to other parents, like we're all just passionate about doing this the right way. And so I'm excited to be here. I'm excited to make positive change. And I know that you all play a very, very important role in that. And so I'm going to be a fly on the wall here, Melissa. And my work from home space, by the way, I wasn't able to do that in my previous role. Obviously, I was when I worked for the county health department. I don't have a good home office set up anymore. And so I've got to get in there and clean that home office out again so I can do these meetings from somewhere other than my bedroom, which is where I am now. So I'm going to turn my camera off and turn it back over to you guys, but thanks for having me.
Thank you, Derek. I'm in a hotel room in Topeka today. So when I got on screen with Megan, they said I look very corporate today. So change of scenery is always good. Just wanted to give you guys for the KDHE update. You have to be under a rock because I sent it all out to the SIT membership. KDHE is going to be knee deep soon in a regulation promulgation process. Say that 50 times fast and you will have a mouthful. Really super excited. It is overdue. It's been a minute since we had Lexi's Law, and then we had some CCD updates, and then we had the huge background check. So it is time to begin looking at our regulations and where we go from here. The SIT team will play a very important role in that because we are very transparent. I've always appreciated that about our program, especially when we went through Lexi's Law and our CCDF updates. Always very transparent in what we want to do and where we want to go. We do know, because we have some of our DCF partners today, that some of our regulations don't meet the final rules within our block grants. So that is a big priority for us to get fixed. And then just looking at our capacity tables, looking at our qualifications, and those are just some that rise up definitely on my list, but we want to hear from you. So be looking forward to receiving some very fast and furious probably SurveyMonkey requests where we want to hear what you see as a priority. And then where, if we're looking at work groups, because when we did this back in 2010, we definitely had small work groups. It really worked well. So even though the SIT team traditionally takes the summer off, I imagine we are going to be tapping you for resources and for your commitment to be a part of this process, and your input is so valuable because you all look at it from a different lens. I'm a social worker by trade, so I always share that I look at certain regulations differently, and that's a good thing. So as we have parents and as we have early childhood educators on board and we have surveyors, everybody looks at it from a different lens, and that's what makes our regulations so robust and so good moving forward. So wanted to let you guys know, again, if you see an email coming from me, and our Survey Monkeys will probably be very timed, meaning you might have just 24 hours to respond. Please be looking forward those. And that's really yeah.
Melissa, I just wanted to say real quick, this is Derek again, and this is the first time I've gone through this process, but we've kicked it off. We're getting some things set into motion. And so that regulatory review is happening currently. And we're very excited about that. The one thing we don't want to do is make hasty decisions. Obviously, we want to include all the stakeholders in this sort of thing. And so, I would just welcome feedback at any point, and any time. And I know Melissa and Jarvis it's been happening already, but I just want to ensure that from my position as well, that we want to hear from everybody, good or bad, because we want to do this the right way.
Oh, I welcome any negative feedback, because that's only an opportunity for us to grow and get it right moving forward. So definitely echo that with Derek. So that is the big KDHE update. So again, be looking forward to that communication. And then Megan, I will pass it back to you.
Thank you, Melissa. We will stay tuned for that. And welcome, Derek. We are excited to have you and appreciate you being here tonight. Okay, so a few updates on our end. I know, I realized I haven't. There we go. Sorry about that. Few updates on our end. We've been talking about the childcare licensing awareness campaign for a while now. I know we've gotten a few sneak peeks We're very excited to share it is officially going to launch on May 12th, which is intentional to align with Childcare Provider Awareness Day. That felt like a very natural time to kick us off and really just, start off the celebration of childcare providers and why quality licensed childcare is so important. So more to come on that. We're working through all the where you'll see that, whether, online and kind of what all the different pieces will look like. But just know that that's coming. It'll be rolled out across the state, and it has been it's been a little bit of a labor of love. So it's been we are just absolutely thrilled to actually see this go public and share it beyond this group. So I hope you're excited as well, and I hope you see that the work that we all work really hard on to advocate for childcare. I hope you see that come through in this campaign. Additionally, we've talked a lot about the toolkit for home-based applicants. That is just about done. It's like 99.9% done. And that's going to be promoted along with the campaign. It may very well be ready to go right before that May 12th date. We're not going to hold it if it is. It's got the very final touches and some final kind of crossing the T's and dotting the I's that need to get done. But you'll see that come out very shortly, and we'll share that as well so that you can be promoting these things because we really want to see them spread across the state and spread across the early childhood system. So stay tuned, but it's really nice to be able to bring things back that came out of this group. Both of these were absolutely ideas that you all put forward, and they are coming to life, which is really exciting. So hope you can kind of take a moment to just feel some pride in the change that we're all making together with this group. You've likely heard about this because it is being promoted all over the place, but we just wanted to make sure that people were familiar with the Childcare Capacity Accelerator. This was launched in the last few weeks. It is through the Kansas Children's Cabinet, and it's a new funding opportunity that is really focused on increasing licensed childcare slots across Kansas. And the unique thing about this money is it's projects can include construction, both new builds as well as building expansions and enhancements, as well as just more operations and sustainability solutions. So there is a lot of information on this link. And Julie or Clayton, if you wouldn't mind putting that link in the chat, that would be great. There's a really comprehensive FAQ on there. There have been a few webinars already that are being recorded. There was actually one earlier today. If you aren't familiar or you're just kind of wanting to learn more, I would point you to that website because there's, like I said, there's a lot on there. There's a special email too if you have any questions. But this is really for communities, which can mean like literally geographically defined communities, or groups like employers or a coalition of school districts, or kind of however you're defining communities to try to solve some childcare gaps in a collaborative way. So we really want to we can't shout it loud enough that this is available because I know capital funds are not easy to come by. And so we want to make sure people know about the opportunity, and that applications are due May 15th. So there's still plenty of time to take a look at it and submit any questions if you have them.
Can I make a quick comment, Megan?
Please do.
Really excited about this opportunity with the Accelerator Grant. KDHE has made a commitment to be very lockstep in partnership with communities. There's some requirements. Surveyors need to be involved. Site approval. It's a very formal process. We actually will be launching this Friday formally on our website, if not sooner. We've updated all of our childcare center applications, and so that it's more streamlined and to get people just through the process in a really in a very timely manner. So whatever you're doing as a community level for the Accelerator Grant, there's really not much more besides some final fire marshal referral pieces that you may need. We really want it to be a smooth transition from the grant to then application at KDHE, and have a very formal process now with site approval. And our team has made a commitment to getting that back in a reasonable manner back to applicants. So again, I think this is a really, can't echo enough what Megan just said, amazing opportunity for funding that we will probably never see again for a while, and really want to support communities in a good manner.
Thanks for that, Melissa. So again, I mean, truly, if you're at all interested, check out the website and submit any questions, because I think everybody's kind of, it's a little bit different because this funding is has some different parameters. So want to make sure communities are getting as much support as they need, as they think through if this is a good fit for them. All right. There aren't any questions on that. I'm going to kind of turn to our monthly bright spots, innovations, updates. Like I said, I mean, we know there's always a lot happening. It seems like the last 2 months, there's been even more happening related to early childhood. So we want to make sure that people can share both the bright spots, but also maybe the challenges that you're seeing, and just some interesting and noteworthy things going on in your area related to childcare. I am going to specifically tag, I know we've got KAC on the line, Kansas Action for Children, as well as CCPC, just given the season we're in. See if either of them have any updates they'd like to share with the group.
Sure. Hi, it's John Wilson with Kansas Action for Children. Hi, everybody. Zooming in from soccer practice. For my kids, so apologize for the informal background. I would love to classify my updates as bright spots, but that would be a misnomer. If it's okay, I'd love to share with the group a little bit about some legislative happenings right now from our perspective. And I know many of you all have been involved in legislative efforts this session, galvanized by the recent Advocacy Day, and then following along with recent action in the House and in the Senate. So I'm going to update you on a couple of things. And if you want to visualize with me, have you ever been to a football game or like a baseball game where on the billboard they have like 3 hats and there's something under the hat and it moves around really quickly and you have to figure out which hat it's in? That is the vibe that exists right now with the legislature and some childcare related bills. Also the vibe, I think Derek mentioned, we don't want to make any hasty decisions. I would classify many of the things happening right now in the legislature as hasty decisions that aren't taking into account the needs and interests of stakeholders. So let's start on the Senate side. Many of you all have been following a bill known as Senate Bill 282, which was a bill that put into statute many of the things that are in regulation now and added new restrictions and requirements and loosened some restrictions in some ways. We don't have time to get into the details of that, but I wanted to update you on where we are with that bill. Yesterday in Senate Commerce, they worked the bill, meaning they allowed for amendments and they voted on the bill. Senator O'Shea provided a multi-page set of amendments to Senate Bill 282. I can't get into the details of all of them today because it's too much to get into, but she claimed it took into account provider feedback and was listening to the needs of providers, and so added those things to this amendment. The amendment passed. Then the bill passed as amended in the Senate Commerce Committee yesterday morning. And what they did after that, though, is they had a bill hearing on an unrelated bill, House Bill 2344. They took the contents of that bill, literally if you were just in a Word document and you select all and you delete it, they deleted the contents of 2344 and put all of the contents of the amended Senate Bill 282 into it. And that's now Senate substitute for House Bill 2344. And as of like 10 minutes ago, we found out that bill is on the floor tomorrow in the Kansas Senate. So all 40 senators will be voting on that bill, which is, again, this 282, this child care regulations bill. So KAC has an action alert actually going out later today to encourage folks to contact lawmakers to express your opinions about those bills. So that's very eminent action. Senate, so you used to be looking for Senate Bill 282. It's now under the hat of Senate substitute for House Bill 2344. Got it? Another related Senate action that there's less to talk about now. Today, there was supposed to be a bill hearing on Senate Bill 234, which related to what's known as social care networks. These are networks that help connect families to programs and services, and they provide referrals in a closed loop referral system. The information exchange is not quite HIPAA information, but it's still sensitive information. And this bill was being pushed by one company, and there was a concern from a number of us that if passed, it would impact our ability to refer folks to childcare services. It might decimate the resource and referral network, and so we were prepared to show up today to provide opposition to that bill. But due to timing in the Senate Public Health and Welfare Committee this morning, they did not hear it. And we've been told by the chair that they have no plans to work it the rest of the week, which means it's essentially should be done for this session. If somebody's not in a truck and can knock on wood, please do that on my behalf. So that does it for the Senate side. Key takeaway, 2344 is being worked tomorrow on the Senate floor. Contact lawmakers if you have opinions or concerns about that bill. On the House side, new action today. So yesterday, late afternoon yesterday, the House Health and the House Health and Human Services Committee sent out a revised agenda with a new item for today that was a bill hearing on Senate Bill, or the working Senate Bill 96, and then also an informational briefing on Senate Bill 282. You remember that bill from the Senate side that literally just passed the committee yesterday? This is billed as an informational briefing. So with an informational briefing, there's no requirement to have proponents, opponents, or neutral conferees. The chair has the discretion to just have a one-sided hearing on something or informational briefing on something. Our intent going into this was an understanding that it was going to be an informational briefing on 282 to update the committee on what that bill contained. As things progressed today in committee, it was clear that all of the proponents for 282 showed up and were prepared to deliver testimony. They clearly were given some indication that this was more of a bill hearing than a bill informational briefing. The chair, Brenda Landwehr, was ready to just end it there and saw no neutral and no opponent testimony. The reason being is there was no call for opponent or neutral testimony because it was billed as an informational briefing. So we were able to kind of raise our voice a little bit in committee and say, we have some opponent testimony. We shared our concerns about 282, namely the process, which was they had what was ostensibly a bill hearing on a bill that hasn't even passed out of the Senate yet in the House Health and Human Services Committee. So what happened was we provided our concerns, and frankly, the chair was not happy with us pointing out the process playing out like it was, not giving time for opponents to come up and speak their concerns about the contents of amended 282. So that informational briefing ended, and then they opened up a hearing on Senate Bill 96, which was an unrelated bill. They did a similar thing. They gutted the contents of 96 and put in the amended contents of Senate Bill 282. So the version that passed out of Senate Commerce yesterday, but still hasn't passed out of the Senate. They put it into Senate Bill 96, and that's now House substitute for Senate Bill 96. That then it was immediately passed out of the Health and Human Services Committee, and the chair has indicated she will have it sit below the line for the next few days while she gathers input from KDHE on the changes that they would like to see to now House substitute for Senate Bill 96, aka 282. If you're confused, I don't blame you. So where we are, the state of play is now there are two bills that are essentially mirror bills to each other. The Senate's working it on the Senate floor tomorrow, and may have the votes to pass it. The House isn't working the bill immediately, but has plans to. They can then come together and conference on something, or one chamber that were made to their bill because they put them in shell bills that were passed by the previous chamber. It gets into a little bit of parliamentary procedure complications, but if it basically shortens the timeline needed to get legislation to the governor's desk. That's where we are with things. I know it's complicated, and I will just say, as somebody who was a lawmaker and now does lobbying for my job, this was a terrible way to legislate, and is not letting the process play out like it should be happening, and letting stakeholders weigh in on something. No immediate bill for action on the House floor. So the focus right now is on the Senate. I don't know if I can take questions, but if people do have questions, I'm john@kac.org. You can email me.
John, you can take questions. This is the CIT team. This is not KDHE's forum. This is really the members team. So that was a lot to digest. So if anybody does have a question for John, please feel free to come off mute, and then we can pass it on to CCPC.
Hey, Melissa, I don't have a question, but I just wanted to reach out to John. Like you said, we have a lot of new staff here. And so this has been frustrating seeing how some of this stuff works, but I'm glad John was there. And I just wanted to reach out to him personally and say thank you for stepping up and having our backs in this situation and allowing something to be said in that instance. So, but yeah, I just want to reach out and say appreciate that.
Hey, that means a lot. Thanks. I'm happy to do it. Mad that I have to do it, but happy to do it.
Any other questions?
Melissa, I have one. What's going to be the next step after today then on the child care bill?
Good question. So the Senate will work the bill on the floor tomorrow. They gavel in at 2:30, I believe. And so it takes 21 votes to pass something in the Senate. And my guess is they likely have the votes to pass that on the Senate side. Since they created Senate substitute for House Bill 2344, I believe the House could just do a motion to concur with that bill, and then it goes to the governor's desk at that point. The governor has, a short window of time to veto legislation. And, we have no indication how Governor Kelly will treat that, but we do know that she's very concerned about undoing things that were established in Lexi's law and jeopardizing the health and well-being of children. And I think also not kind of crafty things without the input of those most affected by the policy change, which is providers and other folks. So between now and tomorrow at 2:30 is a great time to contact senators about your concerns if you have any concerns about this bill. And if you're at a loss for what to say, you can email me and I might provide you some thoughts. But I would say very simply, putting things that should be in regulation into statutes is going to complicate the process should there need to be a change to anything in the future. The regulatory framework provides flexibility and it allows us to respond to unique situations faced by providers and communities. The other thing too is that there are a number of things already happening, things coming through this systems improvement group, things coming through the eventual governor's task force, and other efforts underway that are addressing many of the concerns that are being brought up by proponents of this bill. And by passing things now, we are complicating a process. So if nothing else, a message to lawmakers is, please don't rush this. Let's let things play out and we will address things later. Of course, you'll hear that they don't believe the regulatory process is fast enough and the agency is not responsive enough to the needs of providers. And what is frustrating too, I'll just tell you, is when you hear folks, proponents of the bill talking about this, it feels as if they are speaking on behalf of all nearly 4,000 licensed providers out there, when we know that that is not the case at all. So I don't know if I answered your question, but so it takes 21 votes to pass something tomorrow, and they likely have the votes, but that doesn't mean we shouldn't let them know. An example is in committee yesterday in Commerce, Senator Ware indicated getting 300 emails in opposition to that bill. And others said it doesn't matter unless those people have an address associated with their emails. And so very frustrating. But I think emails and phone calls to lawmakers are still an important thing to be doing on the House and the Senate side. If there's a bill that makes it to the House side, it takes 63 votes in the House to pass something. And it's, they likely come close to having that number. The key would be whether or not they have the votes to override a veto from Governor Kelly. And I think that is less certain at this point.
Yeah, and John, I would just add from our perspective, I think one of the other issues that we've kind of talked about going from regulation to statute. Oh, I'm sorry. I think I muted myself there. Obviously, there's the ability to grant exceptions and such in this new amendment that's been packaged in like 3 different bills. This is the typical, if I understand it correctly, this is the gut and go. Is it not? Yeah. So y'all can look that up and read about it, how it's been used over the years. But we were talking today about regulations and like when we run into issues or feedback with providers where something happens, we try to work with them on everything, right? We try to do our best to address if they're out of compliance or something like that. And so it's a little unclear if we move from a regulation to a statute. What happens if the statutes it's a law, and so there's less, I feel like on our end, and this may just be my opinion, so certainly maybe not reflective of the agency, but even the flexibility to weave in and out of that regulation, if that makes any sense at all, to sort of work side by side with providers. And so I don't know, there's just a lot of uncertainty with it. And I do think from an agency's perspective, we've been pretty steadfast in that we feel like we should not be moving regs into statute. Give us the time to properly review these, to get stakeholder feedback. There's the mention of a survey that was completed several years ago. The world has changed a lot since 2019, as I understand it. And so, we want the ability to properly do this the right way with the team that we have on board working alongside you all. So it's unfortunate, but we'll see what happens.
Yeah, thanks. I appreciate that. And I think I saw Marcy in the chat. The bills to look out for tomorrow: Senate substitute for House Bill 2344. Yeah. That was Senate Bill 282. And then the contents of what is now Senate substitute for House Bill 2344 were placed into House substitute for Senate Bill 96 just this afternoon. So it's likely not going to show up yet on the legislative site, but they are basically mirror bills at this point with different numbers involved. The last thing I'll say, and again, I can say it as an advocacy organization, I guess, on this call, is this effort has been orchestrated and driven by largely business community voices who I feel like believe that if you just deregulate or undo regulations, that this is going to be a major step forward in addressing cost issues and like supply issues with childcare. And I think this is a good reminder for me that many lawmakers in the building still don't understand the distinction between high quality childcare and early learning experiences and babysitting. They don't understand some of the things that we see as just kind of foundational as advocates for children. So that reminds me of the continued effort that we have to have in being in relationship with lawmakers and not letting them run with their assumptions about this profession and this industry.
Thank you so much, John, for that really comprehensive overview. I know it's been a lot to keep up with, so we appreciate you keeping everybody apprised of what's going on and sharing those updates. And I'm sure people will be staying tuned over the coming days and weeks. So, and thanks for doing it with your kids' soccer practice. It's even more impressive.
Of course, I'm sorry I can't stick around for the remainder of it, but I really appreciate it.
No, not at all. We appreciate you being here. All right. Anything from CCPC?
I can jump in. I'm actually very happy that John jumped in first and told you all the nuts and bolts and everything, because basically everything I've come to understand about everything has been from his team. From CCPC, we have done everything that we can to stay informed so that we can be informing our membership and thus the wider community. And you don't have to be a CCPC member in order to access what we put on our social media to try to get messaging out. The biggest thing that I would say is, it is a known fact that within the workforce, the professionals and the educators and, the support behind the scenes and all that, there may be some individualized disagreement on how we come to this. However, the way that things are happening is absolutely an abuse of power, effectively. Speaking as somebody who was able to testify as an opponent, I have been in conversations in the last couple of weeks with some legislators and have noticed that anytime I try to bring up facts and statements that reference whether it's the regulatory information or caring for our children or anything that's based in fact from subject matter experts, I am dismissed and met with eye rolls, and in fact even told that that the person was frustrated and would not continue the conversation. That's not a way to show me that using the legislative branch is actually intended to support my industry. So as a member of the workforce, I'm feeling very much like there's a very peculiar way in Topeka, in the Capitol building right now, of voicing support, and it's not being done in a way that allows everybody to come to the table. With everything that has been mentioned about the promulgation process and everything, the other weekend, CCPC was able to have a very good conversation with Melissa and about the fact that this is opening up. I think in addition to the facts of what John was mentioning, anybody here can take forward, we in this group have worked together for many years and formed working relationships where we can speak to tangible results. But having that collaboration where, CCPC is able to connect with the workforce, I would hope that legislators would be willing to listen to that and back down, because I see everything that is going on, because what we're talking about here with these bills that have been involved in the get and go, that's not even everything that's yet to be discussed in Topeka right now. And it makes me feel like this is a power play to show who, not so much how we're supporting childcare and supporting the workforce and making sure that children are in healthy, safe environments, but more so who gets to be the decision maker. And in that, they're not actually interested in everybody's voice. They want the voices that match to the message that certain people want to push forward. With the KDHE thing, the comment about the authority to assess a civil fine, that was in Topeka in 2018, 2019, and 2020. I think, first of all, there are elements that make it difficult to push that through on its face at this moment. But that would be something to bring up, is why are we focusing on bringing our regulations into statute when the legislature actually, in fact, could take steps to making the process more effective on how we increase licensed numbers and bring the unregulated operation into regulated, supported, professional, networked operation that could be healthier, safer, and done in a way that actually supports the person doing the work. So it's been a whirlwind, and CCPC is doing everything we can to keep up on it. John and his team at KAC has done a good job of keeping us in the loop, and it's just a process. And I'm also happy to answer any questions if anybody has it.
I would like to jump in real quick. CCPC, I think, is a great resource for all of these organizations to get the feedback that they need from the workforce. And we're here for you guys. All you have to do is let us know what you need from us, because not that they don't trust you, but they trust us because we're their people. So you're liable to get more information when we get together with them and can give the information out to them in a clear manner. I think that's one of the big issues that we have is, just like John said, it was so confusing. All that information was, how do I pass that on to the providers to even understand, because they're going to be lost. So we need to figure out how to get that information to them in a clear and concise manner that, makes them understand it and what's going on without causing even more confusion. So social media doesn't blow up overnight, because it will if we don't get the right information out there. So we can host webinars, we can do all those things on social media, but we're glad to be here to help. So just let us know what you guys need from us. And on a positive note, we are hosting our online professional development event this April. We have 150 providers coming. We're really excited to get that moving forward and making some big changes in the community. So I'm done.
Thank you both. Any questions or comments before we're going to switch gears? But I know that was a lot to digest, and there's been a lot going on. So I want to make sure we hold a couple minutes if people have questions or comments.
Can you guys send me a copy of the registration? If you guys still are you taking registration for providers to attend your event? You're closed? Okay.
Yeah, we're done. Now we're sending out all the fun stuff.
Okay.
Because we are full.
Well, send it to us earlier next time and we'll get it out to our surveyors. I know you guys have.
Oh, we sent it. We got it out to them.
Yeah.
So, all right. Thanks.
Okay. Megan, I think we can transition to our next.
Okay. Perfect. All right. Well, I know that was a little different than our usual updates, but definitely felt like we needed to hold some time. So we are going to switch gears. We're going to go into our work groups for about 15 minutes. So it's going to be quick tonight. The groups are each in a pretty good space with, stage with like having draft recommendations. And so we just wanted to go in the groups, see if anybody within the groups has any final comments or questions. And then we're going to come back together at around 7:30 and actually like walk through each of the recommendations, present them, and then see if anybody has questions or concerns. And then what we'll do after that is we will send, slide issue. Okay. After tonight, we will document any questions or concerns. We'll make any changes if needed within the drafts. We will send the drafts out to everybody. We know not everybody could be here tonight, so that you have a few weeks to look at the content. And when we come back together in our April meeting, we will we approach the vote as group consensus. So making sure that the majority feels comfortable actually putting it forward to childcare licensing. So that'll happen next time. We want to make sure people feel as comfortable as possible and have time to review the content and express any concerns. So with that, I think Julia, if you want to
I have a quick question for you.
Please
for
go
us
ahead.
that can't make these daytime meetings, do we just email if we have an issue?
Yeah, absolutely. We will make sure that there's plenty of, we will make sure there's a process so that anybody who can't make it can express anything. And then if either way, we really want full participation. So we will send that out in an email about how do you say yay or nay. Thank you for that question. I appreciate it. Because we recognize that not everybody can, and absolutely want your voice to be heard.
Alrighty, I can open up the breakout rooms now.
Okay. All right. Well, we will, like I said, we'll come back together. It'll be a quick 15 minutes. So we'll see you all here at 7:30.
Looks like we've got everyone back.
Perfect. Thank you. All right. I know that was a really quick time together. So just a couple quick things before we get started. So the way we're going to do this is we'll have a representative, either the facilitator or a representative from each group's going to actually share their screen and actually pull up the document and their recommendation. And these aren't intended to be like 100% perfect. So this really isn't about like wordsmithing, but we want you to focus on the overall content and think about if there are things that aren't clear or things that you just really feel concerned about putting them forth as written. We absolutely want to hear that. So feel free to come off mute or put those in the chat. Again, we're going to send these out in writing, so you'll actually be able to go through and see them. And make sure that those who weren't able to be here today will have a chance to do that as well. Sound good? Okay. All right. Well, since I'm off mute, I'm happy to start on behalf of the provider support group. Okay. So the provider supports group has been working hard on one recommendation that we'd like to put forth, if the group agrees. And that recommendation is to develop a toolkit for communities and partners interested in establishing, strengthening, and/or expanding childcare in their area. I'm not going to actually read this word for word because it's pretty lengthy, but I'll give you kind of the gist. We talked a lot about, we've heard this throughout the CCSIT, that there are quite a few communities and initiatives really coming together to help communities solve for childcare. We know that we're hearing, we know childcare is a problem. We're not really sure what to do about it, and how many communities are getting kind of stuck in that process or overwhelmed because this may not be the area they normally work in. And so this is truly a toolkit for communities wherever they are in the process, whether that's just starting to talk about childcare or pretty well established and just kind of want a reference guide. This is supposed to be kind of the one-stop shop tool to help them navigate licensed childcare. So that could be new childcare, that could be expansion, that could be, again, just making sure everything's up and running correctly. And it's really, it's really intended to reduce the overwhelm, but also recognizing that, there's not a replacement for human support through this process. And so this is intended to be one reference and resource for people, but certainly not intended to replace any of the amazing supports that are currently available for communities. We talked about this really needs to be focused on licensed childcare, and I think we all know and agree that we need some well-supported infrastructure and professionals to provide that licensed childcare. So this is really focused on communities specifically looking for licensed quality childcare. Again, creating one centralized home for this information just to kind of help. We heard loud and clear, like, sometimes information's in one site or in one agency. So trying to just use what we already have in the system and pull it together in one place. The audience, really anybody who's at all interested in increasing childcare at the local level. So that might be policymakers, it could be people in the business community, it could be like childcare task force, it could be providers. Pretty broad audience. And the thought is that if this toolkit is developed, that it's done in a really collaborative approach so that we actually hear from people in the CCSIT, from people in the system, from people in the communities to make sure that the toolkit's being developed in a way that's really useful for them. We recommend that the tool should be available digitally and promoted broadly across the early childhood system. I think similarly to the approach that's been taken with the home-based toolkit that will be available soon. Certainly want to make sure that the R&Rs are aware of it, state agencies are aware of it. And while it's being shared broadly, we recommend that one entity is determined as the owner, just to make sure that the information is being maintained, because like a lot of things, this will need to be a living document, so it's up to date. I think that the one thing we probably spent the most time on is how do we make this comprehensive, but also digestible and also written in language that, a lot of people may not be as familiar with childcare. So how do we write it in language that feels kind kind of like layman's terms so that they can really understand how to navigate such a complex issue. Put in some formatting considerations, things like making it easier to navigate for a section on family childcare versus center-based. And, you know, kind of you think about an actual physical binder, you know, the digital version of that being, I want to click through the tabs so you can find the information you need at the time. Brett shared a great example of a document that he's used in his community that kind of, it's different content, but it kind of shows ways to take pretty dense content and actually make it a little bit easier to navigate and digest. So just wanted to include that. And we do recommend it be digital, but also printer friendly for anybody who would prefer that. The bulk of our recommendation is really the type of content that we think should be in here, which is lengthy, as you're going to see. So these are things that should be considered and grouped, also recognizing that some of this already exists. And so this isn't a need to recreate the wheel, but pulling together resources again, so that communities aren't having to navigate multiple places. So lots of different ideas about things that could be included on childcare facilities. We talked a lot about like models and partnerships and what are other communities doing so that people don't have to feel like they have to come up with a new idea. There might be something they could replicate. The supports available within the system, making sure people know about Communities in Action, the R&Rs, the Go team, all of that. Financing and business supports. So again, it's a pretty lengthy list, but the intent of that is really to just kind of take a look at all the different things that communities may be trying to get information about. And then the last bit of this is just making sure that there's alignment with other early childhood initiatives. We talked about, we know that Child Care Aware and other groups have a lot of amazing resources. We don't need to reinvent those. So leveraging that wherever we can, and then again, making sure that things are aligned with ongoing efforts. And then also, I know we're going to hear from the regulatory group shortly, but we thought that their recommendation that they're going to share, there could be some nice alignment. So that was a lot quickly. Are there any questions, clarifications, concerns from anybody?
I think it sounds great, Megan. Thank you.
Perfect. Okay. Well, if there's not anything else on this one, did anybody else from the provider supports group want to share anything before we switch? Okay, then Melissa, I will pass it to you and your group.
I don't have my document to share, so we have one recommendation we're going to move forward, and that is an interpretive guide. Our team spent a lot of time looking at other states, looking at different initiatives, and really felt the regulated community would benefit from an interpretive guide. We recognize that not all regulation is really put forward in a layman's manner. And so an interpretive guide would be that way to support providers who maybe don't always need to reach out to a surveyor, and that's okay. And they just want to have that tool in front of them to say, now, what does this regulation really mean? And we saw an expansive amount of variety from different states. We really want to keep it simple. And so Anel actually brought up in tonight's meeting that if we move forward with the regulation promulgation process, what does that look like with our interpretive guide? And I shared I was hopeful that they would just still continue to move hand in hand. Our goal is to start with the licensed home regulations, because they're our newest set of regulations that with Lexi's law and then CCDF requirements, they are probably our most cleaned up set of regulations that aren't older than me. So they would be a great group to start with. And plus we have some really primer documents that surveyors have at their use that we can move forward to an interpretive guide. So we will be working with our administrative and policy group at KDHE to hopefully see that this comes to life. At the same time, our regulatory group really spoke about communication. And I made a commitment that we didn't really need to put this in writing, as we were going to do this anyway. It's looking at our survey brochure and our complaint brochure. They really sort of, in my opinion, have a negative tone with it. When you say, instead of discussing like what the process is, and reach out to your surveyor, ask a few questions, it goes straight to, this is what you do if you disagree, and let's do an admin review. Now, that's not helpful for anybody, especially for new providers really trying to understand the rationale behind any type of violation. So Jarvis and I made a commitment to talk about those and move those through our communications group. What I'm really hopeful for with the provider toolkit, they have some really nice graphics, and we can sort of brand, and since I believe, correct me if I'm wrong, Megan, those are our graphics now moving forward, some of those, so we'll be able to use those and have but have a uniformed documents to share with providers. So that's in a nutshell for us, and I will pass it to the third group unless anybody has any questions for the regulatory recommendation. Okay, pass it on to Clayton's group.
Awesome. Well, yeah, so I helped facilitate the systems engagement group, and we wanted to create a recommendation around elevating the user friendliness of the compliant search, and also a way to help kind of foster an appreciation for what licensed childcare is and all that goes into providers being licensed. So I think I'll go ahead and share my screen real quick, if that's okay, to give a little preface for context. This is the starting page for the compliant search. So it provides a little information, and you can see there's a link for search your facility. And I'm just going to go quickly through the process. You go through this search page, and then it comes up with, this is just an example of a provider web page. It shows their surveys. You can view the findings and a little body of text of what you need to know about this report. And this is an example of what a finding looks like, where this one didn't have current immunizations available for one of the children. So that's just a quick overview of, what the process is going through the search. Our recommendation, or ours, we kind of went through that whole process on those web pages and made a list of things that we hope we could update or revise on the web pages to enhance that process. So the first one was make sure all external web pages link to the same starting page. This one came up because, for example, on the Child Care Aware page, when you click on the compliant search, it takes you straight to that search page, which has little to no information on, the actual process of surveys and, what this survey process does and what to look for in this compliant search. So making sure all external websites link to that first page, which has a lot of that crucial information, is important. The next was to create some kind of how-to video or some interactive bubbles for navigation and explaining why things are important. So what are regulations? Why are they important? What should parents be looking for? Helpful context for what people should know and what the value of licensed care is. And we also made the point of having a question template that can aid families in asking providers about previous citations that don't come off, accusational. So that can kind of be helpful for people like me who aren't fans of confrontation. The next one was explore the use of color-coded severity levels. So this was something that we saw on other states' websites, where it showed color-coded ways of going through findings. So you could see like a child's immunization record not having one is a little bit different in severity than leaving a child unsupervised for an extended period of time or something like that. So just a way for people to go through that and better understand what they're looking at and the findings. The next was to show the number of regulations surveyors look for during surveys to provide context for what providers do. So this can help develop an appreciation, a better appreciation for what goes into licensed childcare. It's not just 10 short, things that providers are encouraged to do, but it's actually an extensive process to ensure safe environments. The next was explain next steps for the providers if citations occurred. So if the findings did have a citation, what were the next steps that the provider followed? Did they just send an email update with pictures to the surveyor, or did the surveyor return and visit again to ensure something was fixed or replaced or something? The next was improve the search for facilities by making the search engine less sensitive. If you've gone through the search page, it can be a little bit of a process getting the right information in so that you can actually have search results. It took me a couple tries to do it, so getting that search engine refined a bit. The next was to reduce the amount of PDFs. This is to be helpful for when you're searching the website. If you're searching for content, search engines can't, access content in a linked PDF. So it will be helpful to have more of that content on the web page when people search for it. The next reason why is just for accessibility purposes. If people are using screen readers, it doesn't work for linked PDFs. And then we also have navigation functionalities using the back button on browser versus back to search results. So if you press back on your browser, it doesn't take you back to the search results, but takes you to a different page. So just like fine tuning some of those logistics and navigating those different pages that you're going through, and then also having some better definitions throughout. So defining the different types of facilities and differentiating between complaint surveys and licensing surveys, and explaining a little bit more about the corrective action process. That was kind of what we put together for the need and rationale. It would impact consumers by educating them about the importance of licensing and the process for ensuring safe environments, and help with user friendliness of the compliant search. It could also help with providers by showing the amount of work facilities undergo to maintain licenses and ensure safe care environments. And then for the connections and additional considerations, it's mainly just working on that alignment with other websites like Childcare Aware, KQN, and others that have a lot of consumer education resources. So making sure all of that was aligned and most helpful for people wherever they're going through and trying to enter this facility search process. So hopefully that was a decent overview. Anybody in the group, feel free to chime in. And yeah, I'm pretty proud of what we did, but I'm a little biased.
I like that you had that bit in there of giving some context. It's like, yeah, you may see 2 violations, you may see 10 violations, but knowing that there's 300 some points that we're looking at gives some context of, oh, 10 might not be so bad, but also having that color coding would be really interesting. If I don't know how that works, I don't know how hard it is, but I think that would be something good for lay people. I mean, I look at surveys every day, so, and I'm very familiar with what's a high level versus a low level violation, but parents aren't going to know that. So I think that would be really great context for people outside of the bubble, I guess.
And Clayton, someone shared in the chat that they also like the color coding. I think that I'll be just real transparent with you. We may not get with the color coding because there is some accessibility issues that KDHE takes real seriously within our website. And so you will see some removal of colors on our web pages that used to exist. So not sure what that will look like moving forward, but I personally like color coding too, or just some sort of flag system. So maybe we can put a note there, a flag system, as opposed to as just color coding.
Or even like if it was like a couple stars or something.
Yeah.
Like a 1, 2, 3.
Yeah.
Sorry,
Yeah.
I was trying to type and for some reason it pushed enter after I misspelled but it could even be like high, mid, low. I mean, pretty standard. This is a high level. This is
and that's the verbiage we use too, Tanya. High, mid, low.
Yeah.
I'm glad to understand that. Not that you're having a heart or stroke or something
No.
and suddenly you can't type anymore. So.
Okay, so I have a messed up finger too, so that didn't help. But yeah.
It's a good way to end the evening, Tanya. We'll remember that for a while. Emily.
Well, and I think, ultimately for anyone to make sure they understand, the intention of it is to get at the integrity of the work that the provider or the licensed facility is doing. That, we have humans doing jobs and mistakes happen. And when a person makes a legitimate mistake that is easily correctable, they shouldn't be punished or, seen in the same light as someone who isn't working for, the quality, safety, and health of our young children. And so if somebody has severe violations, this is not an attempt to make, that seem, less than what it is. That needs, we need to call a spade when things are not working well. But for someone who has followed 310 out of the 312 regulations, and one of them happens to be paperwork, okay, well, let's give a little context behind what that really means and whether or not they're really falling down on the job, or if it's just, hey, you're a person and the file was in the wrong spot and kind of thing. Because there are slippery slopes even in that gradation. And so making sure we do it well, but with the integrity of when providers are working hard and trying their hardest, let's not lump them in with the people who aren't trying.
No, and I think I don't see Bethany anymore, but she's online from DCF, and it's really it's a consumer education. It's giving the consumer. It's not just about. I mean, it's information directed right at the consumer so they can make good decisions. I just can't see you, Bethany. I know you're still there. I'm too lazy to scroll over. So thanks for proof of life. I'll have to scroll now, but it's consumer. And she's always, I've been on a lot of meetings with Bethany reminding consumer education. And so it's good to have all of your partners, coming at us and reminding us of why, because if I'm a parent and I have two choices, I want to make a really good decision that is best for my family off of good information. And when you go to our website, it's all there. It's all in numerical order, but what does numerical order mean?
Right.
It's just some regulation variation.
Well, and it goes back to also, Melissa, what I was saying earlier, when a parent goes there, we all understand what it means. But a parent that's off in left field that's never seen this form before, they're lost. So if we've got to make it very super user friendly, or they're just going to scroll right by it.
Yeah, and that's not what any of us want to see happen. Not at all. So very great point, Angie. And as we're segueing towards an end, I wanted to give Jarvis an opportunity because I know he's felt very passionate these last couple of days about everything that's going on, and love when wish you guys were in some of my meetings with him, and wanted to just give him an opportunity to address the group and anything he wants to say as we close.
Thank you, Melissa. Yeah, so Melissa's right. I mean, as I continue to, each week I'm learning something new, learning how things work around here, and learning just different processes. So I really do appreciate this team. I know when I first started on the job, I mean, I was in a lot of meetings, and I found there was a lot of meetings I didn't need to be in. I was just kind of joining meetings because I thought I needed to be there. But I still remember I can't remember, I think it may have been the first time I had this meeting, I had been in so many meetings where it's like I was needing to take information like after every meeting, and there was something I just needed to learn. And after I joined this meeting, like I was just ready, like frantic, like, okay, there's another meeting I got to sit on in and learn and just digest things. And I quickly learned that this had a different feel to it. And I think I told Melissa that I was like, that was a breath of fresh air to get on a meeting where we're talking about something meaningful and, you know, people are giving input and it's really about the work and getting in the weeds and making sure we're doing what we're supposed to be doing for the program. So I'm always going to be an advocate. When I first started too, Melissa told me she was very passionate about this group. She was like, this is one group she wanted to continue to, you know, keep leading on. And so that's what I've wanted her to do. And she's great at it. And I'm always going to be here to soak in what I need and continue learning. So I'm always open to you know, any of the ideas that come up. I know I've had some conversations on the side with a few people on the committee here, but yeah, anything that comes up, we're all open to doing what we need to do to make the system better. And so I appreciate you, Melissa, for giving me that time to speak. So.
Oh, of course. I just want everybody to know. Oh, wait, Tanya, come off mute and share that.
I didn't want to share earlier, but Adrian Ladd, who's with the City of Wichita Child Care Licensing, and I will be at the final phase of what's been a very long process to get an ordinance change for child care providers in the City of Wichita. And tomorrow is the last meeting with the county commissioners, and we will be present to answer any questions, and hopefully it'll get passed through. So we're really excited.
So what you ladies have managed to do is exactly what Jarvis always speaks about. If we can just have conversations, and that's what they did, Jarvis. They met and they had conversations, and now look where they are. They've overcome. And what is the capacity potential to increase in Wichita? I think Adrian said, was it 600?
Yeah, I think that's what we ended up coming up with, because it'll align our ordinance with what state would allow for either a licensed or a group licensed home.
So without doing much of anything, we've increased capacity by 600 just by having conversations at the local level. And the capacity is just going to grow, and it's just going to be great. Now, next to Manhattan, whoever has Manhattan, that's the next group. That's the next one that needs to change. So. All right. Well, thank you guys for being a part of this long evening. And I love that we can have some different faces and enjoy the rest of your week.